everybody. With the Consumer Technology Association, I'm Tyler Suiters. We are the owners and the producers of CES, the largest, the most influential tech event on the planet. We are here to help you get CES ready. The show is January 7th through the 10th, 2020, as always in Las Vegas. And today we are talking about a key emerging technology, digital health. Yes, a big, broad topic. Remote monitoring, diagnostic solutions, digital therapeutics, predictive analytics, it's all there. And CES is the only venue where this entire digital health ecosystem comes together in just one place. And oh yeah, healthcare professionals, you can earn continuing medical education credits by attending our conference programming there at CES, but that may be for another day. Today, we are talking with two exciting voices at very different ends of the digital health spectrum, at least in one sense. We are talking to the CEO and co-founder of NEOFECT. You may not know the company's name now, but there is a very compelling story behind this founder's reason for being in the digital health space. It's a story that you will find personal, and I get the feeling you're going to be Googling NEOFECT soon to check out exactly what they're all about. Also, we're talking to a leading health and well-being company. This is a major brand that you will recognize, and a relatively newly created position. This started just last year. We are talking to their Chief Digital Health and Analytics Officer. All of that is coming up on this edition of CES Tech Talk. Heather Cox is joining us now from Humana. She is Chief Digital Health and Analytics Officer. Heather, welcome. Glad to have you here in studio with us.
Well, thank you. I appreciate it. I'm excited to be here.
So this is still a relatively new role for you, so I don't think it's too late to say congratulations.
Well, thank you. I appreciate that.
A good indication of Humana's growing emphasis on data-driven digital health benefits.
Yes, exactly. And I joined Humana just almost a year ago, not quite yet. But the idea here was to really take a focus around true digital and data and analytics, and really putting an emphasis on not only the experience, but analytics driving the experience. And I really appreciate the way Bruce Broussard, our CEO, really thought about this along with the management team. Really not only saying digital is important, but actually attaching the deep analytics along with it. Really focusing on this like a health tech company would. And when you peel this thing back, when you look at my organization, it really is like a startup, a health tech startup.
So that's an interesting tack to take, especially for a CES-related audience, right? Let's back out for a moment then, Heather, and talk about Humana overall. Some of the key language I know that your company uses to describe itself in this space, supporting an integrated care delivery model, ongoing work to develop differentiated healthcare experiences. Now we can parse all those words together, but the summation is Humana sees the benefits and the potential for the possibilities of tech in healthcare, digital health.
Yeah, it's important. People think of Humana as an insurance company, but we actually really feel that we're more about integrated healthcare. And we're really trying to make the pivot as we want to be a health partner, and we want to be a technology company delivering healthcare. And insurance is an important part of what we do, but it's the financing vehicle behind it all. And we want to be here in a world of aging and longevity. We want to be that partner who can help you live a better, healthier life. And we see technology is the vehicle helping us deliver that. And so what are we going to do to help you find those insights, to help you be there to dance at your granddaughter's wedding? And what are we going to do to help you show up at that baseball game next spring? And, we are focused on helping seniors. We're in the Medicare Advantage business. And so taking care of what could be a very vulnerable population if we're not careful is really important to us. And so helping you through the use of teaching you how to use technology to help you find better ways to live, it's a really exciting place to be. And so things like what we call telehealth and remote monitoring and wellness and being is really important to us, and technology and those digital signals that can exist in a different way is what we're all about. And so digital health is is the next frontier for us. And Studio H, which we founded up and our first location is up in Boston. And what we're building up there is a really important part of our future.
Well, let's dive into that. Studio H sounds like a YouTube channel, right, to some degree. But Humana Studio H was announced just last year, a center for digital health and analytics. And this is a place where, again, that startup feel, Heather, really seems to be tangible, where you're pioneering new products and new services. Where are you 1 year in, and what does Humana Studio H stand for in your mind?
So we were very intentional in the naming and what it's all about. It's the next evolution of Humana, and it's Studio H _H, kind of that compute language, but it's not too far from our brand, because we want to be connected to Humana, but we also want to show a stake in the ground for the next evolution of Humana. And Boston, it was very deliberate choice in that it's also an important part of the future of medicine and the future of health. And when you look at Boston and the academia, the investment and the medicine and healthcare and what all they represent in kind of the future of health in the U.S., I think it's a really important stake in the ground for our company.
And a real talent pool there as well.
Without question. Right? And we have ramped up our talent very quickly there. Since we announced last August, we are close to 70 new hires up in Boston. And so we're super excited about that. We're moving into our new space in Seaport September 3rd. So beautiful new space. And so for any engineers, software engineers, data scientists, designers, we would welcome you to join us. But we are going to hire up to 350 people there in Seaport over the next few years. So we're super excited.
All right. That was a recruiting pitch alert. If you're not paying close enough attention, everyone. No, with good reason. Talk about this transition, if you would, Heather, about becoming a health company, an insurance company, but also a technology company. We love to say it, and everyone can sing along with me. Every company today is or needs to be a technology company, right?
Yeah.
So how is it that Humana is embracing that in a tangible way beyond just this cutting edge studio in Boston? I mean, it's a corporate transition, I'd imagine, starting at the top.
Yeah. So I can kind of point to a few tangible things, right? So if you were to ask me what is my number one priority, how about AI? So artificial intelligence and the real commercial application of it at scale. So what's behind that? Then it's data. Well, what's behind that? We are a cloud first company, and so making that real transition, it's a tough transition in that we are a healthcare company. When you start talking about PHI, right, we have to really be careful about how we handle people's personal health information. And there are, real ramifications. I come from financial services. I understand that, right? We have really sensitive data that we're working with. But we're going to take care of that data and we're going to do amazing things because we want to get to a place where we can not only bring to you personalized, contextualized experiences, but we can also create better health outcomes. And in order to do that, we have got to get to a place where we can have that commercial application of artificial intelligence, because those predictive outcomes are going to save lives, and they're also going to prevent the decline of health outcomes. And this is a really important pivot in where we're headed. And if we're going to have that opportunity to let you dance at your granddaughter's wedding, we've got to get to a place where if you've been diagnosed with a pretty tough situation, we've got to find ways to help you. And getting to the cloud where we can have that compute power, where we can create the machine learning models that can help you live at your home longer, live with your family in a healthier way. We got to get there.
Yeah. Let's walk down that road a little bit. And we'll start by taking a look at the big old sign post that's sitting right here. In AI, in healthcare, and the predictive analytics aspect of it, where are we today, just within your scope, Heather? What is AI giving you and giving Humana right now?
So we have at smaller scale, we've been able to implement some great applications, more in where I would call it the consumer application. So call it in our contact centers, call it in, the application of applications and in the acquisition of customers and how we manage the interactions, less so in where we've been able to actually apply it in health outcomes.
So more efficiencies internally.
You got it. Right. And so the robotics aspects, so that's great. Now we got to apply it in health outcomes. And so we've got a ways to go.
All right, let's go to the next intersection. I'm gonna beat this analogy to death. I apologize.
Please.
Going a little further down, let's say 3 to 5 years. Very hard to predict something that's evolving as exponentially quickly as AI, but what are you hoping for at that point? Let's say it's 2025.
2025, what I am hoping for, how about this? How about my big, hairy, audacious goal? I'm hoping for every one of our interactions with our members are driven by their longitudinal record, and that we have that longitudinal record populated with all types of data, whether it's their clinical data, their member data, their interaction data. So call that their image, their voice interactions, everything. I want that longitudinal record to exist across every type of interaction they've had, clinical or otherwise. That is an insane goal. But we're going for it, and I think it's possible. And I want that to drive interactions for them, for their providers, for their clinicians, for their care teams, and if they give authorization for their caregivers. And so if they have their children, they want to give access to their data and to allow them to give them access to their care, then great. I want that same record to give different views to different populations to provide the right kind of access at the right moment.
Let's then go, I'm going to put just a thumbnail sketch on it, 15 to 20 years from now. So let's say 2040, around there. We are all in self-driving vehicles, right? So highway deaths have plummeted. Cities are smarter, maybe entirely smart, so much more efficient use of lighting and resources and flow of traffic. Voice integration may be everywhere. Who knows what else, what other benefits AI is going to bring as far as making our lives more efficient. But again, where is Humana and the services that you provide, and also the way the business runs in terms of artificial intelligence in 2040?
I'm hoping precision medicine is at its best, right? So that it's truly personalized medicine at that point. And it's really hard to say where we're going to be, but I hope that we all have, right, the genomic medicine is at its best, and that we actually understand down to an individual well before we even get to the point of being sick, that we know what path we're on, if we so choose, right? I think some people will choose to know what path you're on, and some will say, I don't want to know anything, and I'm going to choose to be on the unbeknownst. And I think it's going to be possible for you to be able to understand at age 20 what your future looks like and be able to manage your own path. But I think some people will choose not to know. And I think that's going to be perfectly fine as well. But I also think we're going to be on a path by then to also understand that you're going to live to be 150. So you're going to have to manage your whole finances and everything else a whole lot differently. I think that's a little scarier proposition. So
putting a lot more power in the consumer's hands as well. So I began with a welcome. I should have delivered it a little less literally too, because we at CTA, the Consumer Technology Association, we're also welcoming you, Humana, into the fold. So great to have you as a member. What are you looking for? How did this decision come about for you?
Well, our mission at Humana is to take the health of our members at the center of everything that we do, and the health of their communities that they live in. And so we believe technology is the key to unlocking the focus of their health and the focus of their communities. And so it makes sense. I think it's a good match for us to be matched with the Consumer Technology Association. And we're excited to be a member. And I think the companies that are in your membership are good companies to be colleagues with. And so I think we are hanging in good company, and I think it's going to be a good experience for us.
Maybe that's a new tagline. We'll get hanging in good company. I like that a lot. Although you're new to CTA, Heather, you are not new to CES. You've been to a number of shows, both in the recent past and the less recent past, we'll say, in your various positions. And what a resume, by the way. That's a personal aside. What are you expecting from CES 2020 through this new lens with your focus on digital health, with your focus in and of Humana?
First of all, I'm always awe-inspired when you hit the various kind of floors of CES, and it opens your eyes to just how rapidly the world is moving. Every year, you're just kind of just amazed at what leaps have just happened in the past 12 months. And what was really fun for me was when I hit in 2017, just it had been a few years since I had been, and just the gasp you take of just how much you've missed in the last few years of not being there.
Well said.
But I think for me now, having a view through the lens of healthcare, just what can we do to really press our industry to go even further? And when I talk about that, it's we as payers need to press harder and harder to take the lens of what can we do more for consumers, and how do we take health and the well-being of our membership even further and keep it at the core of everything that we do. I think Humana has done a beautiful job over the last several years of keeping their member at the center of every decision they make, and how do we take that even further and take it to the next level? And I think CES is just a bellwether of the companies that show up there. That's what they excel at. They're taking the consumer-centric view of the world and taking it to the next level. And we'll be excited to be there. We are aiming, my team is aiming to show up and to have product on the floor to show off as well.
Excellent.
Just a little
That's
little
one
preview.
foot. Yeah, that's 1 foot out from beneath the curtain.
Yeah, show a little leg out there, right? So, but we're excited. We hope to have something very exciting to be talking about ourselves. So,
final question, Heather. What about the conversations you have, the people you meet, the business synergy that you find at CES?
Yeah, I think it's always so exciting to find kind of the next business opportunity and partnership for what can we bring to our customer? What is the next new opportunity for an integrated product or service that you just didn't even know existed before? And that's what's so cool, because it could be somebody just even sitting right next door to you, right next to you, right? And I think you always find, even if it's not a specific product or service, just the next great idea gets sparked, which is really cool.
I'm always surprised how frequently that happens to me in an Uber or a Lyft or even a taxi on occasion. Just sharing a ride gets you a lot of insight. And like you said, you never know whom you're going to wind up next to. Heather Cox is Chief Digital Health and Analytics Officer with Humana. Still somewhat fresh to the job. Heather, fascinating discussion. Will you join us again sometime?
I would love to. Thank you so much.
All right. And we will see you at CES 2020 in just a few months.
Fantastic. Thank you.
With us now is Scott Kimm. He is the CEO and the co-founder of a company called NEOFECT. And Scott, yes, it's great to have you with us. As co-founder, you have an immense amount of responsibility, certainly, but also maybe the strongest vision of anyone in the company as to what NEOFECT is and what you expect it to be.
Yeah, so our vision is our motto has been the same, ever since our foundation of the company. Our motto is we inspire hope, and as visionary as it sounds, as broad as it sounds, that has been our vision, and it is our vision. So basically, our belief is that there's a lot of people who need more healthcare or who just need more caring. But at the same time, not everyone can have the similar level of benefit, and especially in the United States. So I don't know, like growing up in Korea, where healthcare works a little bit differently, and both, Hoyang, the other founder of the company, and me, and the other founder, Young Choi, like we all had experience like living in the States, and we thought like technology can help those who are in need, but who are not getting a lot of help. And healthcare hasn't necessarily been the very first, sector that accepts the like technology.
Mhm.
So we thought like we could actually like help those people like using the technology that's available and that's readily available like on our end.
Well, let's talk about who these people are in your mind, Scott. I mean, when you say people who could use this or people who need that, some of these, to speak in pretty direct terms, are folks that are going through fairly common traumas, right? People recovering from stroke, people with perhaps debilitative diseases. These are not uncommon issues.
Yeah, exactly. I mean, like our like target customers or patients are stroke survivors,
Hmm.
and there's a lot of like stats that back this up too. But majority of people like who have a stroke, like they end up being staying at a home, and then like just to stay on the couch and watch TV and not do a lot of things like for rehabilitating themselves. And according to survey and many other things, that we experience like on a first hand, it's just because like, some are educational issues. Like some people are just like not aware of the fact that they can get better. And some are, personal issue too. So, but we do know that like, things can get better even after stroke. And the thing is like, just because of the neuroplasticity, it's basically the role of use it or lose it. And they just need to keep working on their, brain so that their brain can start relearning things so that they can engage themselves in day-to-day activities like more easily and then more actively. So we do want to help these people, and they may not be like quite common in our lives, but at the same time, it's pretty common that they're like desire for getting better, getting something that means a lot to them, like back to their life. Like this is pretty serious thing. So we've been targeting these like stroke survivors, and like what we are doing is like for them actually to be in an environment where they can actually like engaging themselves with the rehabilitation in a easier manner and more comfortable manner like in the comfort of home.
So, paint a picture for everyone who's listening today, Scott, if you would, of exactly what your smart
Mhm.
glove is. I mean, that's primarily the product we're talking about. And I would set it up in that it's looks a lot like an exoskeleton, right? That covers all the fingers and the thumb and
Yeah.
goes maybe halfway or a third of the way down the forearm. And I will let you take it from there.
Sure. So smart glove is, I mean, like the description of the glove is like pretty accurate, and like I don't know how it looks to you, but it's extremely lightweight device. It's 4.5 ounce, and it's quite like like more light. It's lighter than your smartphone.
Hmm.
So, and it's not extremely hard to wear too. So we've been really focusing on usability. But the main part is not the hardware itself, like it's actually the software. And so what it does is that once you wear the glove, then what happens is all the motions that you're making with the glove on, with your own hand, are recognized by the software. So what we're coupling with the glove is the game contents. So for example, we have a lot of like games that are simulated, into your life. For example, pouring the wine and catching the baseball and cooking and, even like playing billiards and then fishing, things like this. There's a lot of like different content games that you can play. So for example, if you are thinking about, like the fishing game, then you're making the motion with your own hands. It's kind of like handshaking, like shake your hands like vertically up and down, and but it kind of looks like you're actually like like just just lifting up the fishing rod like up and down so that you can like start fishing. And so doing so actually get your rehabilitation results like come out faster. And then these are all the proven clinically proven activities, and Stanford is like one of our clinical partners too. So like going back to the crux of what we do is we basically deliver like a tablet with the smart glove, and what they do is like they get paired up with one of our clinical managers who can actually like coach them through like how to use the product, and then go through the evaluation result. And then based on the evaluation results, the artificial intelligence actually comes up with the algorithm like on its by itself, and then like keeps like giving them like all different recommendations, just like Netflix works. Netflix already knows like what kind of movies you need to watch, you want to watch. Mm-hmm. And our algorithm actually, after the evaluation, and basically every time the session ends, like algorithm actually knows like what kind of games and activities like that they need to engage themselves in, and then go through the basically play the games, but at the same time they go through the rehabilitation process in their journey of stroke.
Mm-hmm, mm-hmm. Why we'd be remiss not to talk a bit about your story, Scott, in that you don't come to this sector, to the marriage of technology, digital health, the ability to deliver what really are meaningful, life-changing benefits through technology by accident. I mean, you have a very personal and involved story here, right?
Yeah. So I was actually born with spina bifida. It's a type of disability that anyone can be born with, and it has like probably like 0.01% of population gets born with it. If anyone is a mother or father, like this is like one of the diseases that doctor tells you in advance that the kid is gonna born with it. And unfortunately, I was one of them, and so that means that I went through a major surgery, and then after the surgery, I had fair share of rehabilitation in my life, like growing up.
Wow.
So the thing is, like I was actually pretty mild case, so I was pretty lucky, like to get better, and then to get myself engaged into lots of just normal activities later. But growing up in South Korea in the early 80s, like rehabilitation was not my favorite thing growing up. So I thought it was pretty boring, and I mean even in the eyes of 80-year-old kid, 90-year-old kid, like I really felt like this was kind of aimless, and that this is boring, and I couldn't really tell where I was, and I couldn't really tell like what it means to be successful in terms of rehabilitation. So fast forward, then I came to Thornton, it's the University of Virginia's business school. And then I met another guy who also came from Korea and who had like completely different background, but whose father actually died of stroke. And then he was pretty emotional about this disease. And we met another guy who actually told us that, we can make something for stroke patients. And this is big issue in America. But we can make something more engaging and more objective way of rehabilitation using the data. And then once we heard that idea, both of us, we got really clicked for two different reasons, but two relevant reasons. So this was very personal to me. And just because fast forward, I came to America when I was 22 first time. And then ever since then, I came to UVA later and then had an opportunity to check out, the rehab setting. But surprisingly, 1985, 6, South Korea, which was not the same country even back then. And then 2010, 11, America. And the rehab setting was not too different. So meaning that I was really telling myself and my other co-founder that, we really have a shot here because it looks like technology is something very distant, seemingly, in American healthcare, although this is a country that actually leads all the great technologies and everything. So, yeah, and then like once we were really like inspired by the idea, and then like got to see where the healthcare is in this country, then yeah, we didn't look back, and then like started just like like working on the idea from then.
Getting back to business strategy, Scott, you are a CES veteran. NEOFECT has been at CES a number of years now. 2020 will be your fourth year exhibiting, I believe. Correct me if I've got the math wrong there. What is your game plan going into the 2020 show? What are the lessons you've learned, and the best way you found to leverage the audience and the attention and the opportunity there?
Yeah, so this year definitely like we have like a clear direction about like what we want to achieve like in CES, and so far like past like 3 to 4 years, like it's been phenomenal experience like by attending the CES, like lots of media exposure, and I'm really thankful with that. Like we were able to be covered by like major media outlets such as CNN or CNN or on Fox TV and everything. So it's been so powerful, like to be able to meet wider audience and like get feedback about the product. And so far we've been really like focusing on delivering what we do and then what this does. And so we've been really focusing on the like functional aspect and technological aspect. But like from this year, we're going to be focusing a lot more on reaching out to a wider audience, just because like we know how powerful this event CES is, and just because like I know like how much support that we can get from CTA, which we really appreciate. We would really love to like focus on like being able to reach out to a wider audience. So you may not be there's a good chance that you are not a stroke survivor yourself, but everybody knows somebody and somebody knows everybody. And so there's a good chance that, like we get to meet people and then get their attention, they talk about it, and then, we can actually like start helping, like broader audience.
Scott Kimm, CEO, co-founder of NEOFECT. Great to have you with us today, Scott, and look forward to reconnecting in just a few months at CES 2020.
Yeah, thanks for having me today. I'm really looking forward to CES 2020. Thank you.
All right, we are here to help you be CES ready. So make sure you subscribe to our CES Tech Talk podcast. That way you won't miss a single episode as you're gearing up for the 2020 show. We are on all the platforms where you expect to find the podcast. As for the big show, CES 2020, it is January 7th through the 10th in Las Vegas, as always. The information you need is at ces.tech. Now, none of this is possible without our true stars, executive producer Tina Anthony, and our senior studio engineer, John Lindsay. You guys are the best in the business. I'm Tyler Suiters. Let's talk tech again soon.